Okay, then if you're going to actually start with the feet region, what you can actually do here is actually kind of compress the foot like this. So again, if you want, you can actually compress and hold, bring it out, compress, hold, bring it out, compress, hold, bring it out. Remember, the kidney meridian actually starts in the bottom of the foot here, okay, and then goes up. So you can also, both hands like this, kind of stimulating these regions. And if you want, again, you can actually, both feet at the same time, you can incorporate the techniques going up. Then you can also go up, and remember, if you need to, the nice thing is you can actually put your knee on the table, just going up. But you remember, on the tibia bone here, not a lot of pressure, okay? So you're more on the lateral or the medial side then, going up the body. And the patella, the kneecap area here, like that, make sure you're not putting pressure right on there then, okay? But make sure you can just go up the body like this, okay? So again, you can use different techniques going up the region, okay? And then the inguinal area, make sure you don't put a lot of pressure right in there, because you're more likely, there's an actually inguinal pulse there, because you don't want to restrict blood flow or problems. There's actually a huge collection of lymph nodes right in that area. So for the lymph nodes in the inguinal area, and then also the armpit region, those are the 4 main areas for lymph nodes. And then also, the only place on the back of the body is behind the knee. Remember, the popliteal region, that says lymph nodes. So make sure you don't put a lot of pressure in that area. Okay, so for the leg area, you can actually, if you need to, you can get to more of the posterior side. You can actually kind of ratchet it, going out the body. You can start over again, going up it. So you're kind of using their body weight for pressure then, as you go up. Then you can actually flex the knee, externally rotate it, bring it out here, so you can get more the adductor region, but remember the meridians as they go up, okay? So just palm it up. And it's safe at least 3 to 4 inches before you get to the inguinal area. Just kind of make sure you go around this way, just to make sure they feel a little bit more comfortable that way, okay? Then you can also bring up the knee like this, and actually kind of lean back and press too, okay? And a little bit more support, you can actually ask permission to sit on their foot, but then you can actually get more of resistance then too, okay? But then you can also go down the anterior part here. You put your anterior shoulder here, and you just compress down the quad region then, okay? And make sure when you're performing these techniques, there's not a lot of jerking motions like this kind of thing, okay? So if you are doing those jerking motions, more likely you're using too much pressure of your own self. So that's why I just slow it down a little bit, okay? Make sure it's nice and rhythmic and relaxing then, okay? Okay, next one what you can do, you have to extend the leg like this. We're going to hook this on the anterior shoulder right here. So you can actually work the anterior, posterior, lateral, and medial side of the leg then. So you can actually compress, going out the body then, okay? All these regions. And some people, this is actually stretching, but even normal, it would be straight up and down. That's 90 degrees normal for hamstring stretch. But the thing is, just make sure if they're ever in discomfort, remember the areas that they're going to tense up is in the toes and the fingers, even in the face you can actually see now, okay? So you can actually do a little bit of movement too with these regions. And you can also put this on the anterior deltoid region, shoulder region, so you can actually move in, so you can actually get more of the posterior part of the leg like this. So you can actually get your knee up on here a little bit, and just compress, kind of pushing all these regions in. But again, watch your facial expressions, make sure. And you can also kind of bring it out